Hello, good afternoon. This is Dr. Sreedhara and my associate, Dr.
Ashish Parekh.
We are coming from Fortis Hospital, Banerghatta Road, Bangalore, on the occasion of World Kidney Day. Greetings to all the viewers. We would like to give some brief information about the theme of the current World Kidney Day, which is education, prevention, and early detection of chronic kidney disease. The theme of the current 2022 World Kidney Day is kidney health for all, that is increasing awareness about the kidney disease. So in that regard, I'm going to speak about chronic kidney disease and take your questions at the end of this presentation. So as you know, 1 in 10 people in the world have kidney disease, and the most common cause of kidney disease is diabetes. Nearly 40% of diabetic patients, that is 4 out of 10 diabetic patients, may develop kidney disease, and some of them will end up on dialysis or transplantation due to kidneys failing completely. Please note that a lot of patients with milder or moderate forms of kidney disease may actually not survive till dialysis because they also have very high prevalence of heart disease, and therefore they actually die of heart attacks and strokes long before they end up on kidney failure. So, as I said earlier, uh, kid, the focus of World Kidney Day is to increase awareness about kidneys and kidney diseases among all. So each of us have about 2 kidneys, which receive nearly 1 liter of blood circulation every day, and these filter blood and remove waste products and produce urine. So, although about 1,000 liters of blood goes into the kidney every day, about 1 to 2 liters of urine is formed, which is basically waste products that is filtered in the kidney and also secreted by the kidney. And when these waste products are not removed by the kidney as they should, then they accumulate in the blood and cause kidney damage uh, slowly, and that is called chronic kidney disease. When it comes to diabetes, as I said earlier, about 40% of diabetic patients may develop kidney failure, kidney disease, and ultimately it leads to kidney failure in some of them. And a lot of them may not survive till kidney failure and have other heart diseases or strokes, etc. So the earliest form of diabetic kidney disease is the uh, detection of protein in the urine called microalbuminuria. That is, small amounts of protein is filtered or secreted in the urine, and that is called microalbuminuria. And subsequently, over the next several years, serum creatinine, which is a blood test, increases over in the blood, and that is gradually increases over time. And as the kidney function is declining, the level of serum creatinine increases. And when the patient's kidney function is less than 10%, what we call as stage 5 chronic kidney disease, the patients develop symptoms and they may require dialysis or transplantation. So the for diabetic patients, it is essential that they monitor their urine for microalbumin, so that at the onset of microalbuminuria, they can take proper precautions to slow down the progression of kidney disease. And to slow down kidney disease, there are medications that are given, and also proper control of blood pressure and diabetes is very, very important. So I will ask my colleague, Dr. Ashish, to tell about the medicines that can be used to slow down kidney disease in diabetic patients.
Good afternoon, everybody. So, as Dr. Sreedhar has told, the diabetes is the commonest cause of kidney failure worldwide. And detecting early is of paramount importance because if we detect early, we start treatment early, then the disease can be prevented from worsening, and in some cases, mild protein leakage can be reversed. So the medicines, there are a lot of medicines which have been which are used to prevent kidney disease progression. The two important drugs which we use is one of what we call as ACE inhibitors. These are basically blood pressure medicines which also reduce the pressure on the kidney, the filter on the kidney, and help in retarding the protein leakage from the kidney, as well as progression of the proteinuria from, that is protein leakage, from mild to higher stages. There is one new medicine, what is called as Sglt2 inhibitors have come. These are the new drugs and have shown to be very, very sugar medicines, which also help in controlling blood pressure, and they also help in preventing kidney failure. They also help in patients with heart diseases, even with or without diabetes. So these are the new which have come, which help in preventing protein leakage and prevention of kidney failure. In addition, there are other drugs which should not be taken, specifically painkillers, which can potentially damage the kidney.
So, as Dr. Ashish said, use of certain medications to lower the blood pressure, such as ACE inhibitors and angiotensin receptor blockers, as well as some diabetic medicines, such as Sglt2 inhibitors, such as dapagliflozin or empagliflozin, etc., help in slowing down the progression of kidney disease. Please note that the kidney disease, at least in CKD, in any patient and diabetic patients, is divided into 5 stages. One is stage 1, when there is only protein leak. Stage 2, when the kidney function is between 60 to 90%. Stage 3, when the kidney function is between 30 to 60%. Stage 4, 15 to 30%, and stage 5, less than 15%. As I told earlier, it is in stage 5 the patients develop symptoms that the patient requires dialysis or transplantation. The problem with kidney disease is that during earlier phases, the patients are completely asymptomatic. A lot of times patient come and tell, I am completely normal. Why are you telling me that I have kidney problem? So it is not uncommon. It is very, very common. Most patients will not have any symptoms until very, very late in the course of the disease. Therefore, it is very essential that patients check their kidney status early on, so that we can take the medicines that Dr. Ashish mentioned and monitor the patient closely, so that their kidney failure progresses slowly or controlled and does not progress at all. The reason we must control the progression of kidney disease is that when the kidneys fail and dialysis is initiated, the patients do not do well, because although dialysis is life-saving, patients on dialysis suffer from various problems such as infections, heart diseases, strokes, etc. In fact, the survival of dialysis patients is actually worse than survival of cancer patients. So therefore, it is very important to prevent. Every year of postponing dialysis is very important, because the patient will live that much longer. And when it comes to the treatment of stage 5 kidney failure, when the patients are symptomatic, I told you already, dialysis is one treatment where the blood is cleaned. Kidneys do not get better, but the blood is cleaned. And that cleaning of blood has to be done regularly, 3 times a week. The patient has to come to the hospital or dialysis center. When the blood is cleaned, and the patient goes back home and comes back again. But as I told you, dialysis is not a replacement for the normal kidneys, because now the dialysis can only perform certain functions of normal kidney, but not all the functions that the normal kidneys do. Therefore, a better option for diabetic patients or any patient with kidney failure is transplantation. And I'm again going to request Dr. Ashish to discuss about transplantation and what patients should be considered and what it involves. Ashish.
So transplantation for people who are eligible is the way to get rid of dialysis. In the sense, a successful transplantation obviates the need for continuous dialysis. The quality of the life as well as the longevity of the life in a successful transplant recipient is much better than that of a patient on dialysis. Therefore, for all eligible patients, the transplantation is the better option. But unfortunately, many people are not candidates for transplantation, either because of their age or because of their comorbidities. Comorbidities means associated diseases like a severe heart failure, lung failure, a previous history of a debilitating stroke, bedridden status, recurrent infections. So those are the people who may not be candidates for transplantation and unfortunately have to continue on dialysis. So the treatment, as has been told, is dialysis and transplantation for a person who has stage 5 kidney disease, what we call as end stage renal disease.
Can you describe about the procedure of transplantation and how to go about it?
So the transplantation involves a kidney from a healthy individual or a person who's a brain dead living either, or a brain dead person who donates one of the kidneys to the person who's suffering from kidney failure. So after doing appropriate matching and seeing that it is of the mostly of the same blood group and it is a healthy kidney, one kidney is taken and put into the person who's suffering from kidney failure, that is a person on dialysis. It involves use of severe immunosuppression to prevent what we call rejection of the newly put kidney. There are few tests that have to be done to ensure that the rejection rates are lesser. But even despite all the tests, there is always a risk of rejection. And the person who gets the kidney has to be on lifelong medications, what we call immunosuppressive medications, to prevent rejection. Uh, so, apart from that, then in India, there are many hurdles to donating. One of them that the person has to be, as mandated by the law, has to be a near relative, which is in law has been defined as a real brother, real sister, parents, grandparents, children, grandchildren, spouse. In exceptional circumstances, permission may be taken apart from near relatives to donate as altruistic donation. That is in the living donation. In cadaveric donation, a person who has brain dead and is having a functioning kidney is eligible to donate, provided the family or the next of the kin agrees to donate. The person has to be certified by local state authorities as brain dead, and then after appropriate consent, the kidneys can be harvested and put into the person suffering from renal failure. There is a waiting list, unfortunately, which sometimes runs into years for a person on dialysis who has to wait to receive that kidney.
So, as Dr. Ashish mentioned, transplantation involves a donor who is a near relative or a deceased or a cadaver kidney. The reason we recommend transplantation is because the patient survival is much better and the quality of life is much better with transplantation in in eligible kind of patients. So, if a patient is eligible and willing, transplantation is the best treatment option compared to dialysis. However, a lot of patients are on dialysis and it is a life-saving procedure. But more, like I said earlier, it is better to slow down the kidney disease progression, and especially in diabetic patients, control of blood sugar, that is HbA1c less than 7%, blood pressure, less than 125 by 75, 130 by 80 or less, and diet control such as low salt diet, avoiding non-vegetarian foods, and most importantly, avoiding painkillers such as brufen, nice, Voveron, Combiflam, etc., and adopting healthy lifestyle habits such as exercise, avoiding smoking. All these put together will minimize or slow down the rate of kidney function decline and hence postpone the requirement need for dialysis or transplantation. So I think this is a brief information about the diabetic kidney disease, and a detailed information about kidney disease in general. What you need to know is actually enclosed along with the who is interested may please download the same from this website. And at this time, we would like to take, if there are any questions, we would like to answer. The cost of dialysis in India from hospital to in private hospitals, it may cost between 2 to 2,500 rupees for dialysis session per dialysis session as an outpatient. Whereas in private charitable institutions, it may cost to 1,000 rupees. Transplantation cost also variable. Transplant in corporate hospitals may roughly be around 4 to 5 lakh rupees for the transplantation procedure per se, and in government hospitals it may be about 1 to 2 lakh rupees. Transplant patients also need to take medications lifelong, that is the immunosuppressive medications, which may cost about in nowadays maybe 5 to 10,000 rupees per month. So therefore, over long time, over 2 to 3 years time, transplantation works out to be cheaper than dialysis, because the dialysis is a recurring expense, whereas transplantation is a one-time expense and recurring expenses are minimal. And moreover, life is significantly better with transplantation. Therefore, for transplantation is a superior and a cost-effective option. Like I said, but is interested, you can download the presentation about what is. It is a very general lay person presentation.
Thank you.